Hello, everybody. Kelly Tenney here. Welcome back to the Caring Without a Care podcast. Anand and I have been talking about the four principles of lean care, and today's topic is all about training. Welcome back, Anand.
Thank you, Kelly. It's good to be back again.
I know in our previous episode, you explained a little bit about training and what training actually has to do, why it's one of those core foundations of lean care. And today I would love to ask you to expand a little bit on this concept of training and talk more about why and how training is important for the success of a care management business.
Kelly, at the heart, long-term care is a people's business. We have individuals taking care of other individuals, supported by a lot of individuals. So training is important because at the end of the day, we want everybody to be better in what they do. So if you are a caregiver, you get better in caring for your clients. If you're office staff, you get better in doing what you are supposed to do. And if you all get better, the world will be a better place.
I love that. And as you know, many of you know, I have a long time background in education. So my heart is always in the training conversation, right? But when it talks, when we're looking at someone who might be listening and saying, okay, I know that there are some mandatory trainings that we in this industry have to attend and maybe the staff have to attend as well. But for a business owner, when they are thinking about training internally, where do they start? How can they start, developing that plan to implement and to deploy the trainings within their company?
But Kelly, it all begins with an introspection or a self-assessment. So if you are a business owner, ask yourself, what is the one thing that keeps you awake at night? What is your biggest problem? What is the biggest hurdle that you face every single day that sometimes forces you to think, should you stay in the business or should you quit? If you find that one thing, then start answering these questions and why do you feel that way? And most of the times, as you start asking these questions, Kelly, people will find that they can get better in certain things. For example, if I am losing my peace of mind because of employee retention issues, perhaps I need to get better in employee retention because the world around me is not going to change. We have the inflation pressures, we have people who are quitting at a faster pace. We are not going to change all of those behaviors, but we can change certain things internally within ourselves as individuals and also within our organizations. So start with that one thing, and then eventually you will follow a blueprint of your own.
Thank you for that. And I know you have such an extensive background and expertise when it comes to care management. I would love to have you share some of your insight around what types of trainings that you've seen to be most effective when it comes to training a team.
And in this industry, I find that the most practical are on-the-job trainings. So for example, if I am a business owner, I would like my new employee, whether it's a biller or scheduler, to be trained on the particular function that I'm expecting them to work on. So that's the first part, which is a functional training. Then the second training is more of a behavioral training, which is on soft skills. If you are hiring people who are not coming from this industry, or even if they have been in this industry, but they would need to polish their soft skills, um, that area, the importance of that area, I cannot overstate because soft skills are some things which people sometimes take for granted. But in a multicultural society like ours, how you address individuals matters a lot. Just giving you an example.
And I really think it's important to talk about too, like the length of training, right? Because we want to keep in mind that while you're training, whether it's in soft skills or your specific industry related skills, that you're training people that are working, right? You're training people that have a job, they're potentially working for you part-time or full-time. They probably have families and other things to do. And, I really think that the length of training is something that we want to keep in mind so that we don't further overwhelm our staff. Can you speak to that, or can you speak to training in length when we compare, for example, some of those mandatory trainings with the time and length of training that we should be providing internally?
So, Kelly, in this industry, generally the mandatory trainings, which are 8 hours, are called in-service trainings. And usually I've seen them work from anywhere from 15 minutes duration to 30 minutes duration, especially in a classroom setting, even in the virtual courses. But what we are talking about here today, and that's where I would value your expertise too, is even a shorter duration of micro learning. Because what we are finding, especially after COVID era, is people don't have patience to even sit in front of a screen for 30 minutes, especially if the total training of 30 minutes and is for 30 minutes and they really care for three. So what are your thoughts, Kelly? Let me ask you this question. On micro learning, what have you seen work in the past 2 and 3 years?
Well, that's an interesting question. I mean, something we see about micro learning, especially coming out of the pandemic, is that more and more corporate trainings have moved into this micro learning concept. And the concept of micro learning is that it's very short and specific. So if, for example, and I know we've used billing, right, as an example, if there's a 10-step process to billing, micro learning would maybe provide specific trainings around each step versus a very long training that shares all 10 steps. So giving the staff member space to go through each process, each step one at a time at their convenience, instead of requiring an hour or 90 minutes to go through the entire step. And what this will do, you know, and you talked about like on the job training, is this will allow them to practice each step on the job before they move on and master the next step, which I think not only reduces overwhelm, but increases the mastery and the skill as well.
I think that's very well put. And I think this is something that you and I will be talking about a lot in our future episodes as well.
Mhm. Yeah. And I do want to add the importance of assessment as well, right? Recognizing that when we're doing micro learning, just because the learning is short doesn't mean that we should skip the evaluation or the assessment piece. And Anand, just off the top of your head, what are a few things that are specific to care management um, that would be important to assess in terms of the skills within your team?
So, Kelly, when we look at our team's skill level, we always look from two perspectives. Consider that as a XY chart, efficiency and effectiveness. So by efficiency, I mean how much time does it take for someone to complete a task? And effectiveness is whether the task was done the right way. So if you think from the perspective from a biller, the example you mentioned, was the biller able to complete the billing in a shorter amount of time frame? And secondly, was it done without making mistakes? So if you start analyzing the effectiveness of each training, you will find that the entire agency or the entire business gets better, both not only in terms of saving time, but also in delivering better quality results.
Thank you. And I know when it comes to training and education, that lack of assessment or evaluation is something that's often missed in a lot of corporate training. So I appreciate you sharing that and giving our audience an idea of what some of those evaluation points might be. So thank you again for talking to us today about training and talking a little bit about the different types of trainings and things that all of our listeners could be considering if they're looking at developing and implementing some type of training within their business. I know on the future sessions, we're going to continue these conversations around lean care. So Anand, as always, thank you for joining us.
Thank you, Gally. As
And
always, it's
thank
my
you.
pleasure.
Thank you to all of our listeners with the Caring Without a Care podcast. Be sure to subscribe and share this podcast if you know others that are in the caregiving industry. We will see you back on future episodes.